Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So a few days ago, I made a video about one of our clients as part of our membership for families of critically ill patients in intensive care that you can get access to at intensivecarehotline.com if you click on the membership link or if you are going to intensivecaresupport.org directly. And there, our member and client was saying that her dad earlier in the year went home with a tracheostomy, with a PEG tube, and the hospital basically just sent him home without any support. Now, that could be a death sentence because patients with a tracheostomy, they actually need intensive care nurses 24 hours a day. Now, at the time, we were very concerned and we warned her not to go home, but the family wanted to give it a go, only to find that he bounced back into hospital and ICU pretty quickly because, once again, patient with a tracheostomy and the PEG tube really needs intensive care nurses 24 hours a day. You can actually find the evidence for that when you go to intensivecareathome.com and you go to the mechanical home ventilation guidelines that clearly say that intensive care nurses at home are needed 24 hours a day for tracheostomy or ventilated patients. It can be done, but it has to be safe, of course. Now, obviously, client bounced back into ICU. We then were asked to look at the medical records, and I will, read out what the medical records say so you can actually have an idea how bad it was to send her dad home with a tracheostomy and a PEG tube without intensive care nurses 24 hours a day. So the remedy here really is if you are in a situation like that where your loved one, wants to go home with a tracheostomy or with a PEG tube, or go to intensivecareathome.com. At intensivecareathome.com, we actually send intensive care nurses into the home 24 hours a day for medically complex ventilated and tracheostomy patients, adults and children, by the way. And we also send critical care nurses into the home if patients are not ventilated, have a tracheostomy, or if they're BiPAP, CPAP ventilated and not have a tracheostomy. We also do home TPN there. So let's look at the details of what happened when her dad went into hospital. As of now, the latest doctor's reports available in your dad's online chart are, per the infectious disease progress report, your dad is alert but not very responsive, has a wandering gaze. His vital signs documented appear to be stable with a temperature of 36.7 Celsius or 98 degrees Fahrenheit, pulse of 79, respiratory rate of 18, blood pressure 111/62 with a MAP of 78, a good oxygen saturation of 98%, on aerosol tracheostomy collar with an oxygen flow rate of 5 liters with FiO2, 5 liters of oxygen per minute with FiO2 of 28%. Notable findings include a sacral pressure sore, also known as decubitus, wound with surrounding infection, which puts him at risk of a sepsis. He actually is diagnosed with a sepsis, infected sacral decubitus wound, anoxic brain injury. Noted MRI had shown early stages of sacrococcygeal area osteomyelitis. The plan is to treat with antibiotics at least 5 weeks more to complete a 6-week course of osteomyelitis. He's planned again for discharge home, but he does need a PEG line for long-term antibiotics. I will come to that in a minute, what a PEG line is. Further recent gastroenterology notes anemia noted likely due to chronic disease and blood loss from deep sacral decubitus ulcer. No overt signs of GI bleeding. Fecal occult blood test positive, likely from sacral pressure sore. No immediate plan for endoscopy. Noted fecal impaction with green-brown stool, and he has been disimpacted. Per the physician report, discharge summary notes on the 12th of April 23 noted that your dad presented with sepsis from a sacral wound, osteomyelitis confirmed by MRI, recommended 6 weeks of antibiotics, wound care and monitoring. He's seen by the surgeon to evaluate the need for debridement. It is recommended that the wound has a very thin layer of necrotic tissue type and be removed by enzymatic debridement. Noted altered mental status resolved with plan for possible discharge with IV antibiotics to be arranged. He is on full code. Per surgery note, noted that your dad has stage 4 sacral pressure sore with mild necrotic tissue and no signs of overt infection. Necrotic tissue means that actually the tissue has died. No immediate surgical debridement is needed. Collagenase ointment is recommended. The plan includes daily wound care with dressing changes. Per the cardiology on the 4th of December, no change and appears to be comfortable. His most recent lab report shows white cell count is normal, but on the high side, his hemoglobin is 8.7 and no further monitor. He's positive for occult blood, which means now that blood has been detected in the stool sample. So in a situation like that, you know, her dad should have never gone home, with a tracheostomy to begin with, right? And, you know, like I said, with a service like intensive care at home, that would have never happened. Now, with intensive care at home, we're currently operating all around Australia. But even if you're in the US and the UK, please contact us as well. Now, you know, and people don't do their research. They just trust in the hospital system blindly. You know, you have to do your research and, you know, look at alternative options and not just trust the hospitals blindly that they can just send your dad home and not have the adequate support, right? Now, he probably needs a PEG line to get long-term antibiotics. And again, the PEG line sits in front of the right heart. And again, management of a PEG line needs a critical care nurse at home as well to manage that. You know, again, the biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. So now, if you want advice when you have a loved one in intensive care, or you want intensive care at home, you know, for intensive care at home, please check out intensivecareathome.com. If you want to be a member for families of critically ill patients for daily advice, go to intensivecarehotline.com, click on the membership link, or go to intensivecaresupport.org directly to get access to me and my team 24 hours a day in the membership area and via email. And you can answer, and we answer all your questions intensive care related. I also offer one-on-one consulting and advocacy for families in intensive care. I talk to you and your families over the phone. I talk to doctors and nurses over the phone or on video. I ask all the questions that must be asked, and you haven't even considered asking, so that you get peace of mind, control, power, and influence when you have a loved one in intensive care. I have worked in intensive care for over 20 years in 3 different countries, where I also worked as a nurse manager for over 5 years in intensive care. I also represent you in family meetings with intensive care teams, that you don't get walked all over, and that you know what's to come, that you know how to position your loved one's treatment or loved one's condition to get best care and treatment. We also offer medical record reviews in real time, so that you make informed decisions, get peace of mind, control, power, and influence, and that you can have a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence. Now, all of this you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com. And once again, if you need intensive care at home, go to intensivecareathome.com. If you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, or what questions and insights you have from this video. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.